So this is the book on navigating changes in healthcare, managing change effectively for healthcare professionals. Now, this book is written very specifically with practical tools and insights to currently navigate the complexities of in healthcare transformation, whether it is in hospitals, public health, health systems in across a region worldwide. It looks at leadership and change management role in making these changes sustainable and make impact in your organizations. Overall, what we are looking at is that how as a healthcare professionals, if you're leading these initiatives, make them sustainable, last in your system, and rather than looking in very short term or not even making an impactful way of looking at that change management perspective. So in last my 20 years of experience working around these areas diversified into hospitals, public health and health systems across various countries and leading them through various pathways of sustainable change management. And especially when I'm talking about leading initiatives, programs across these regions, I able to do them successfully across, when I say regions, so it could be in Asia, Southeast Asia, Pacific, Middle East, Africa. So I felt that this experience wanted to bring out a practical approach for healthcare professionals to learn from these practical tools, learn and apply their workplaces across the globe so that it serves as a guidance mechanism. And most importantly, that there's not much written about this topic in the healthcare sector. I wanted to contribute to this area with these case studies, enough evidence literature and tools so that the healthcare professionals in the sectors can make use of them, apply, gain more experience. And for us, overall, it would also make an impact in the sector, where as an organization, we are evolving in the sector. I would like to contribute and make this happen. And that's the endeavor for me to bring my experience into a book and ensure all the healthcare professionals benefit from it. So the book is largely for healthcare professionals aspiring and also for healthcare readers who want to really make a sustainable impact and also to make really a change in the communities and the societies they are working. So this is for people who are working in various areas of hospitals, public health, health systems. So whether you could be a hospital administrator, a nurse, a manager, a program manager, a public health manager, or a health policy, a health analyst, or a health systems person, it should work as a learning tool and as a guidance with its practical tools, insights, and a global learning experience and knowledge which will be being shared in this book. And especially it has a chapter and book caters to healthcare students who want to learn. And there's a career guidance chapter which looks at helping them how to build their pathway in making a meaningful career and also to reach the goals which they are aspiring. All this has been put in such a way that students in healthcare, as well as healthcare professionals and the healthcare leaders, can make use of this book uh, to the best of their abilities and also apply and ensure that this knowledge can also then amplify to larger healthcare sector. Yes, that's the right question. So the book basically is navigating changes in healthcare, which is how you navigate all the complex changes which are happening in healthcare today. Technology is changing, regulatory space is changing digitally. We are moving across the medicines which we are producing, the delivery models, the capacity building training. So everything is evolving very fast now than in the past. And with the changing models, the way we need work, how do you manage those effectively for healthcare professional? Which means that with this changing, the leaders and the people who are in the system should manage these changes very well, which are sustainable and make that impact which leads and lasts. So, so overall, in summary, what it means is that when you lead and take any initiatives in healthcare, how you want to implement these changes that last, sustainable, make impact in your organizations. It talks about practical tools, case studies, and experience sharing by experts to bring out this learning in a concrete way to learn and apply. This is what the title means. Yeah, so the first and most important thing is that these are practical tools available in the book, which are of real life experience and wisdom. Case studies and insights, along with global experts, bring out what it takes to manage change really effectively. Most of the time we talk of leaders, but how this change really make happen is an important aspect to be looked at. It also addresses comprehensively in this book the challenges which you are facing in our world today, which we see on a day-to-day level in all the organizations and places we are working. One is how do you want to manage resistance, especially looking at the context and the culture. How do you sustain change over time when you want to build transformations, whether you want to do it in 5 years, 10 years, beyond your quick fixes, doing quickly, how do you want to look at really sustainable change over time? Then you're looking at cross-functional alignment. We know that structures work in silos. How do you then foster collaborations and ensure common goal orientation for all the people? And one of the other aspects it talks about is capacity building, how role of mentoring, coaching, and leadership development programs in creating future-ready healthcare leaders. We also looked at balancing priorities when you're actually navigating very clearly between patient outcomes, patient care, quality outcomes, and cost. How do you really balance the priorities? And most importantly, when you're looking at leaders in healthcare transformation, what you require is developing essential qualities for effective leadership, which is self, and how do you develop those traits, competencies in these complex environments, and looking at a perspective of change and the models and the tools and the insights to make it happen, which means is that when you combine both, you'll be in a better position to handle change, but make it more effective. This is what is gets captured in the book, and these are the key takeaways. And this looks at a truly global experience, looking at all experts and insights, make it very applicable for all the target audience, especially the healthcare professionals, to learn and apply. Yes. So the reader can, it's a easy-paced book, well written and in good font size. So suggest is that the readers can go chapter by chapter at their own pace and spend more time in detailed case studies, its tools and its models and how they're applied. So I would recommend to go chapter by chapter, but if time is an issue, there are specific chapters they can go directly, which are the sustainable management, healthcare transformation settings. And also there's a specific chapter on career guidance for students who want to just try to read on that specifically. They can go to that chapter, which looks at how healthcare students uh, have pathways to take to reach some of the aspired roles in healthcare and what it takes to reach that position. So it is well written, detailed out. They can read those chapters. So I would recommend go chapter by chapter if you have time and take your own way so that you can ingrain all the learnings and then you can learn and apply. Yes. Uh, once you read the book, you can earmark specific areas of case studies relevant to you, models, tools, and insights which you feel are significant and helpful. You can make your own notes and then you see how you can go and apply at your own workplaces, whether it's your hospital as a program manager in public health, health systems, or in policies, or you're working at any nature which impacts healthcare. You can look at how you want to apply. Now, once you know where you want to do, take it to your apply at your workplace, see how it works, see how you have gained experience. Once you see the sum of the outcomes, you can build further from there as you gain more confidence. And probably from there, you can explore more things to do and actually then take this to more places. And you could be the change agent, which we are looking at by learning from this book. Reader can reach out to me through LinkedIn. You can type Girish Bommakanti So you can reach out over LinkedIn, or you can write to me over my email ID, girix46@gmail.com. I'll be more than happy to respond to your comments, feedback, or suggestions. In healthcare, for last 24 years, I've worked across major regions in Asia, South Asia, Southeast Asia, Pacific region, Middle East, Africa. In managing, leading, growing hospitals, I built a lot of primary healthcare models, innovation in microinsurance, technology, and I've been also consulting throughout my work and my exposure and experience in this region in various spaces of both public and private healthcare. Given this wide experience and nature and learnings around this interconnected healthcare ecosystems, the diversity, complexity, the people, the culture, the practices, the processes, and the system, though it is healthcare, but it is so diverse and it's different, and its application changes, and how you can make it really successful. So when I led major initiatives across regions, globes, I learned a lot during this exposure. I learned both successes, failures, but I learned most importantly how to make it happen. And that's where I felt that these capacities can be brought into a sort of a book which captures the learning experiences, knowledge, insights, which could be shared with my fellow colleagues, professionals, and students who can learn from this and take this forward, and also build a future ready leaders and change managers who can really bring change in their workplaces and in healthcare, and we move forward to much more sustainable change management and impact. That's why I brought with my work all this enriched experience and learnings and insight into a comprehensive book, which is a can be a guide for you or could be a strategic companion and help you throughout your phase to help you to become a leader and a change manager.